Welcome everyone. It is Friday, May 1st, May Day, and there are some flowers outside, so make sure you get out this weekend. It's going to be really nice to look at the flowers. I've got a couple of suggestions about that after I give you the case count update, but I'm glad to be with you again today. We have no new cases in La Crosse County at this time. We still remain at 29 total with 26 recovered. A total of 2,166 negative test results in our county. That is about 1.3% positive to the total number of test results. At the state level, we did see a significant increase in the number of positive tests from yesterday. So we are currently at 7,314, and that is up 460 from yesterday's numbers for positive test results in Wisconsin. Negative test results, 72,566. That is up 3,172. That is a percentage then of positive to total of 9.1%. So that percentage is about where it's been in the upper 8 to the lower 9 percentile of positives out of the total numbers that are being tested. The hospitalizations are currently at 1,544. That is up 32 from yesterday and is 21% of the positive cases have that hospitalization need. So that is down a little bit from previous. The total deaths are at 327, which is up 11 from yesterday. I just really dislike when I see numbers increasing on the death side. So we do continue to have our fellow Wisconsinites. There are a number of folks in our state that have severe disease requiring hospitalization and do not survive from this virus. So something to keep in mind that when we ask ourselves about our need to continue with all of the recommendations, I think that's what I usually come back to, knowing myself someone who is in that number. So just thinking about all of those who are family members of those that have passed from COVID-19. I want to give some information on our first 26 cases today. So I'm going to move to my PowerPoint slide set and share with you some details about our cases up to the first 26. So I'll go into slideshow mode here, and you should see the first slide, which talks about an overview of the cases in La Crosse County. We are looking here at the first 26 cases, as I mentioned. At the time when we did this data review, we had more than we have now that we're still recovering. So we have 26 of 29 right now, but at this time, recognizing 17 of 26 had recovered. So just know that this is the data relating to our first 26 cases. So as far as demographics go, we had ages, I have to move my, can't see my, okay, so we had individuals that were under 60, was about 77% of our total cases. So we are seeing a continuation of younger folks being tested and having positive test results. In terms of the history of pre-existing medical conditions, this is again with individuals who tested positive. About 63 to 64% had existing health conditions. So not only were they younger, but they were with existing health conditions. So I think that's important to note, because we know that risk levels are those that are over 60, but also those that have pre-existing health conditions. So these are the individuals, about 63.6% had these existing health conditions. So we're thankful, despite this high percentage, that we haven't seen severe disease with requiring hospitalizations or having any deaths in our county. I think that's very good news to point out. The gender with the first 26 cases was equally split 50-50, males and females. We looked at like municipalities and where we were seeing individuals that were in our case counts, 62% of those being in La Crosse, the city of La Crosse, 19% in the city of Onalaska, and 19% in other areas of our county. Looking at community spread metrics, so the number of the first 26 cases that we could attribute to community spread was about 27%. In addition, we look routinely at where individuals have been going, and we look back 48 hours before symptom onset. So before they noticed any symptoms, we ask, where have you been? And when we investigate these cases, we heard from folks that they had been in one or more stores 48 hours before becoming symptomatic. 42% indicated that they had been in one or more stores. And then we also asked, what about after symptoms? And I don't want this to alarm you, so I'm going to speak about this slide for a few seconds here, that 46% went to one or more stores. So we look very closely at these cases, and you know that we have not yet had to notify large groups of people in our community with something like what we did with the funeral a number of weeks back, because we are able to very carefully narrow down where they were in those stores, what type of contact or interaction they had. And even though this seems high, 46%, these were not exposure incidences that warranted us notifying the public. So I want to be very clear, we ask that question all the time. Do we need to notify the public if we cannot fully control knowing who they were in contact with? Then we will send out a notification, and I want to continue to reiterate that will happen. So we ask lots of detailed questions, and many of these were we could determine that there were not exposures outside of who we could notify. I know there may be questions about that, but I want that to be very clear, that our team looks carefully at that, and if there's ever an indication that we feel a notification needs to occur, we will do that. In terms of symptoms, I think this is important because on the media briefing on Wednesday, I talked about this particular slide and how we have added some symptoms from the Centers for Disease Control. And this slide shows you the percentage of individuals in those first 26 cases that had any of these symptoms during the course of their illness. So this doesn't tell you that this was what they had for symptoms at the onset. It may have come on very mild in the beginning and then added some other symptoms as the illness progressed. So this is at any time during the course of the illness. Predominantly, we still see our residents who have tested positive have been in these purple bars at the bottom with muscle aches, fever, and cough. But we have seen this introduction of loss of taste and smell, which I think is a really interesting symptom and one many people wouldn't normally think about. This was in 26% of our cases. And I've seen that be particularly in younger age groups. So I think it's important to know that there is a wide variety of symptoms, and many times these symptoms come on very mild. And we know that there are the likelihood that there are individuals that have no symptoms and therefore are not getting tested. And we know that there are folks out there. Severity of symptoms then among lab confirmed patients, 15% of our clients in the first 26 cases had severe symptoms. And again, this may or may not require hospitalization. We've only had, I believe, one who has required hospitalization out of our 26. So then you've seen this slide before as well, and I'll just touch on it again. This is the slide that indicates, so looking at our region in the orangish color, our county in the green, and Wisconsin in the purple. The bar, the red box, is around the date that the safe-at-home order started, the original order. And you can see that the rate, which is a cases per 100,000 population, at the county and region level have been significantly lower than at the state of Wisconsin level. And I do believe that a big part of keeping this lower had to do with the safe-at-home order, because it restricted movement and travel in particular, so that the risk areas not being inside our county as high as they are, those risk levels being outside our county and other aspects of the state or other states or other countries, that travel restriction reduced the ability to bring the virus more readily into our county. So I think that made a big difference, positive impact in our county with case numbers and rates. And then looking at the percentage of tests that were positive in La Crosse County compared to the state, and I routinely talk about this percentage, and you heard me talk that today's percentage for La Crosse County is actually under 2%, and the state of Wisconsin is currently at 9.1. So we've come down even from this slide, and the state has gone up a little bit from this slide. So we continue to increase that gap. And just noting here that we are uniting against this common enemy, which is the virus and not each other, and we're working together to win this fight. So at this point, I want to just make a couple of other announcements. You may have heard that, so our department communicates routinely, weekly actually, with health departments in counties all around us. So Buffalo, Trempealeau, Jackson, Monroe, Vernon, Crawford. I'm trying to go slow for Colleen because I'm being really, and those are all in Wisconsin. And then in Iowa, we communicate with Amaki. And in Minnesota, we communicate with Winona and Houston. So we are routinely communicating with counties around us. Weekly, we meet. And at the last meeting we had on Wednesday, Buffalo County shared with us that they were going to have a community testing event. So you may have heard about that testing event. I think it's important for Buffalo and Pepin to have gone together with that event. I used to work in Buffalo County and they have no hospitals there. So if you are wondering if we are planning to have a community testing event in our county, I want to let you know that we've been in partnership and communication routinely with our healthcare partners. And again, they are increasing testing. We just spoke with them again today, and they have let us know that they are going to be testing any symptomatic individual, again, that goes through their normal process where you call your healthcare provider, and then you get looped through a screening process to determine that you have symptoms and would need testing. If there is a situation that happens where you have symptoms consistent with COVID-19 and are not getting tested, we recognize there may be some gaps in that process. So we would just ask you to let us know, and we will work with you to make sure that that gets tested. So I think many healthcare providers, but definitely ours in La Crosse County, which serves a significant region of counties around us, are going to be testing symptomatic patients. So know that we are not currently planning to have a community testing event because our healthcare providers fill that gap for us. We don't have a gap because they do an excellent job with testing and have been ramping up and will continue to be ramping up. So we're super grateful to our healthcare partners for all that they do on the testing side, because that takes a significant amount of time and energy away from the local response. Even though the National Guard brings that mechanism in and the testing actually happens through a statewide entity, there still is the coordination aspect of making sure that things get communicated appropriate at that local level. So grateful that Buffalo and Pepin have that testing event, but just want you to know we don't currently have a need in our county to do an event like that. I think it was also interesting to learn that Menards and Costco are now going to be requiring their customers to wear face coverings while shopping. I think that goes back to the importance of understanding that face coverings make a difference in the spread of this virus. So when we are out shopping, again, essential travel, essential shopping for groceries, things that we really need in order to maintain in our homes during this process, it's important for us to wear those face coverings. It helps make sure that if we have the virus and don't know it, which is possible, there are a number of people, even in our surrounding counties, particularly thinking about testing that's happened in Winona and other counties that have asymptomatic, they don't have symptoms. And so we want to make sure that we're protecting others in case we are one of those that doesn't have symptoms and has the virus. So we may not feel sick. We might have very mild symptoms that feel like allergies or something else. There are also people who have true allergies. We've talked about that before too. So please refrain from judgment if someone might truly have allergies. But the point here is to be wearing face coverings when we're out shopping to protect others and therefore they are protecting us if they are also wearing face coverings. So I think that's a wonderful start for big businesses like that to be promoting face coverings and requiring them while shopping. Menards also indicates that they would sell you a face covering for $1 if you don't have one and need one. So I think that was important to share. In addition, though we should not be traveling on airlines, US airlines are requiring facial coverings on flights starting in May. So we do see this trend where requirements for face coverings are coming about. And I think that is a positive way for us to keep the spread of COVID-19 down, particularly as we think about weeks into the future here, where we may be able to open up additionally if we continue to have low case numbers and low metrics of other indicators we look at to make sure we are ready for that, to do that safely. Then we might be in a place where we have additional movement, and having face coverings on will help prevent the spread of this virus as movement increases over time with where we go from here. This weekend, as I mentioned, is going to be a very nice one. At least that's what our meteorologists tell us. So we are grateful and looking forward to that nice weather. We encourage you to get out and do some hiking, do some walking, some running, other outdoor activities that you enjoy. Fishing is the opening fishing weekend is this weekend. So if that's something you enjoy, is being out there fishing, golfing as well. There are many activities outside that we encourage. We would just say, remember that this should still only be with members from your household. And if we're using similar facilities like a boat dock, for example, just keeping your distance appropriately. All of that is important to remember to be doing. Campfires have come up as a question, and just a reminder that in certain areas, you do need to reach out to your local municipality for a burning permit to do campfires, and that should only be occurring with your household members, not be traveling to another place to participate in a campfire, things like that. Not having neighbors over for your campfires, that would really be back to the safer at home order and essential travel only. So I think, just remembering that we are not yet at a time where we can be participating in kids having play dates and having meals with other individuals outside our household. So we continue to encourage you to stick with those recommendations so that we can move forward out of this safely. Those are the updates that I wanted to share. I'm now going to turn it over to Dr. Eberlein, who is going to share some information with us, particularly in regards to the emergency room and appropriate use of emergency room. Thank you, Dr. Eberlein, for being with us.
You bet. Thanks for the updates, Jen. Very, very informative and helpful for all of us. So I'd just like to start by saying a few brief things. One, I just wanted to reiterate a little bit what Jen said and the face coverings, how important those are for us as a community to get back to resuming our normal, by cutting down on the infectious rate of this virus by using face coverings. It really does move us towards getting back to normal life, so to speak. And so please continue to use those when you're out in the public. It's asked that everyone that comes into the health systems is using a face covering. It does not have to be a professional looking mask. You can use a scarf or a bandana, something just to keep your exhalation from spreading around the room that you're in. And then of course, hand washing. Continue to do the frequent hand washing. That's very, very important on the spread of disease in general. So I really encourage people to continue to do that. We have done an exceptional job in our community with this thus far. So please keep doing that. And that is how we're going to get out of this as fast as we can, for sure. So a couple of things I want to talk about as far as hospitals coming in the hospital. We have seen some delays in care and people looking for emergency or coming in for emergencies. And as with any disease, the sooner that we get a patient in to take care of them, the better the chance that they will do. So please do not delay in coming to the emergency department if needed. We have been and will be able to handle the caseloads that we have right now. And we can take care of both the COVID patients and those that don't have COVID. We can take care of emergencies. We have great policies and procedures in place to separate these patients. And there's no reason, if you need to call 911 or seek out emergency care, that you should even, it shouldn't even cross your mind that you shouldn't do that. So just as before, if you thought you need emergency care, please seek it out. What I don't want to see is what has been noted in some other areas in the country where their out of hospital cardiac arrest deaths have been very high. Stroke numbers have been very high because people haven't been getting their usual care. So these are the things we really want to avoid in our local community. And the way to do that is to come in when you need to be seen. And so you're not a burden to us. We are able to protect you and ourselves in this time. We've got appropriate PPE to do so. So once again, please come in if you feel you have an emergency.
Thank you, Dr. Eberlein. Just so much appreciate you and the work that you do both with Tri-State Ambulance and the emergency room. And I think that your message is really, really important to our community with knowing that some people might have a fear about doing that, and there really is no evidence that they should. So grateful for your message. Thank you for sharing that today. At this time, I think we are ready for questions if the media have questions for us to answer.
Hi, Jen. Marcus from News 19. So you mentioned earlier, could you just clarify that you said you think that there will come a time when La Crosse County tests for symptomatic patients, but that there aren't any plans for the immediate future to have a community test?
Okay, so we already have community testing through both of our healthcare systems. So what I was referring to is that we aren't going to bring in this process that the state has allowed with the National Guard. That's what's happening in Buffalo and Pepin County. So I knew that some residents might wonder if we were going to do the same. So I was clarifying that at this time, we are not asking the National Guard to come in and do a community testing site in our county. So we will continue to utilize our existing testing processes, which are the health systems, and they are already ramping up testing to assure that anyone with symptoms should be tested through our current healthcare system mechanism. So again, that means you would contact your healthcare provider and they would appropriately route you to determine where you should be tested.
Hi, Jen. Justin with WKBT. I kind of wanted to take a step back and look at your slideshow, particularly the one with those pre-existing health conditions. Do you know by chance or offhand which of those pre-existing conditions were, or what kind they were, I guess, in short?
Yeah, that's a very good question, Justin. I do not have that specific data today to share with you. But often what we see, and I don't know if this is the case with the 26 patients that we have had positive tests for in La Crosse County, but often here we're looking at conditions that weaken our immune system. So they might be on certain medications that lower our immune system functions. They may have lung disease or heart disease or other underlying medical conditions, kidney disease, that put them at risk of having more severe symptoms if they get COVID-19. So I don't have the specifics about those underlying conditions in our 26 cases, but often those are the ones we're looking at.
Marcus with News 19. So could you explain why it's up to our two healthcare facilities to decide whether or not we would need one of those community test sites through the National Guard, like in Buffalo County?
Yep, so it is not necessarily up to our two healthcare facilities. It is a partnership. It would be a resource that the health department would request through emergency management should we feel that that resource was needed. At this time, we do not feel that that resource is needed. Our healthcare providers are ramping up appropriately to be able to support that need in our county in particular. At some point in the future, if that is no longer the case, or if we have a need to test a specific population, then we will certainly request that resource from the state. But at this point in time, it is not a current need.
Justin with WKBT again. Kind of going back to your slideshow once more. Kind of looking at those stores when you said that with community spread being in them and kind of going there before as well as after they showed symptoms, I guess, were the stores notified, and did the stores really do anything to like clean or kind of notify the public that, you know, some of these people may have been exposed and kind of inform the public more or less?
Yep, good question. So those are details that happen on a case-by-case basis. So let's just say, and this wasn't necessarily the case, but let's just say one of our positive cases comes in. We do disease investigation, which we've routinely talked about what that looks like. It includes looking very detailed at what they were doing up to 24 and up to 48 hours prior to symptom onset. So we start with symptoms, of course, and when symptoms began, and we're good at figuring out, even if they were mild, when did they really begin? And then we ask specific questions about, you know, where were you during those days, all the way up until the present moment that we're speaking with them. We do a number of prompts to try to get them to remember where they were, because this can be hard sometimes. So we even ask them, look at your calendar, you know, look at your phone, if there are things that will help trigger your memory about what you were doing. If we find out that someone was in a store, we ask a number of other questions to determine the risk level. You know, which store were you at? How long were you in there? Did you have a face covering on? Where were you in the store? How big is the store? You know, so it helps us determine the level of risk. So for example, if somebody goes into a very small store, no one else is in the store besides the workers at that store, and they had a face covering on, then we are likely to notify that store to make sure that they are aware of that for their workers. But again, that doesn't mean that there was an exposure in that store. And then oftentimes, you know, we have had even where the stores will help us determine if their workers recall if anybody else was in the store, because we don't want to miss somebody that the client didn't think about, but the workers did. So we are very comprehensive in that investigation process. Now, is that 100% perfect? No. But again, I want you all to hear from me that if we have any inkling that there is a concern that others in the public need to be aware of, I have no problem at all making a statement that says, if you were in this store during this time to this time, we think you may have been exposed, just like the funeral situation. So just because we haven't had that and we know that there have been folks in those stores, doesn't mean there's been any exposures that we are concerned about the public needing to be aware of. I guarantee you that we will notify the public if there is a concern about an exposure that we cannot verify at a detailed enough level. So I just want to be really clear about that, because I know that people worry about this a lot, and I understand that concern. And I want to be really clear that we're absolutely always talking about, is this one we need to notify the public about? Because I have no problem doing that. I would rather people be aware of the potential exposure than not. So just know that that is something I routinely ask that investigation team and push on quite a bit.
Jen, this is Caitlin with WISM. You had mentioned that you work with a lot of surrounding counties, including those in Iowa, and Amaki County has been seeing a lot of large spikes, and we've been getting questions as to why that is. Any indication of why Amaki County is such a hot spot?
Yeah, so again, I think it has to do with, you know, there are a number of plants in Northeast Iowa that they are doing a lot of screening on, not necessarily in Amaki yet, but in other counties surrounding them. And they are routinely screening, or not routinely, but they are like comprehensively screening everyone who works at those plants. So they are getting cases out of that screening process that's happening outside of their county with people who live in that county and work in other counties. So I think that's a significant reason why they've had so many cases come in, that there really are localized outbreaks happening in work sites.
Marcus from News 19 again. So Jen, if everybody kind of who wants to get tested can currently get tested at our local healthcare systems, and we wouldn't need one of those National Guard tests, what are the pre-screening requirements?
To get a test, Marcus? So I'm
Yes.
okay. So what I think you're asking, let me know if when I answer you, I didn't completely answer your question. Our message will be, if you think you have been exposed to COVID-19 and don't have symptoms, or you have symptoms that are similar to COVID-19 and you don't know for sure if it is COVID-19, then you need to call your healthcare provider, and that provider will route you through the screening process to determine your need for testing. And my understanding from our conversation with healthcare partners today is that they are prioritizing testing for individuals who have symptoms of COVID-19. And again, they may talk you through those risk levels, and they may determine that, they're very sure that you have allergies and not COVID-19. So there are clinical conversations that happen there to determine whether or not testing is needed. But I am being told that individuals who have symptoms should call their healthcare provider and can get tested. Again, there's a conversation on the clinical side to determine if that really is needed.
Justin with WKBT again. Can you hear me?
Mm-hmm.
Oh, perfect. My name tag was popping up. But earlier you talked about, as well as Costco and Menards requiring people now to wear masks. I guess it's kind of a 2-for-1 here. Do you feel as though that will kind of open up to other markets like Walmart or Festival, for example, to requiring people to wear masks when they come to the store? And if that happens, I guess if people don't have a mask, or maybe they don't have masks available for them to buy, will they be barred from entering some of those stores in order to get just essential needs, essentially?
Yeah, good question. So this is about wearing face coverings in stores. So I do think, and I hope, we have been recommending to businesses in our county for a week and a half to 2 weeks that their workers wear face coverings. I am really glad to see lead businesses identifying the need to have customers wear face coverings. Again, I think from a worker standpoint, that's important to make sure that their workforce is not exposed. Those workforces are critical, particularly to make sure that we have food supply that is not impaired. So I think on both sides, the worker side and the shopper side, that having face covering requirements is a good step. I think it will be a really impactful way to decrease the virus spread as we begin opening our state when that happens after the safer at home order. So as far as whether or not they will be barred from entry if they don't have a face covering and there isn't an ability to purchase one, if it's available or not, I think that will be up to the local business to determine with regards to their policy.
Marcus with News 19 again. Jen, Governor Evers talks about increased testing being the key to moving forward. So could you foresee our healthcare systems relaxing maybe that criteria through the phone screening process?
So as far as relaxing criteria through the phone screening process, I am not well versed in what that looks like. I am being told, however, that the testing is being ramped up, and we are seeing that. We are seeing more tests in our county, and we will continue to see that increase. And so I think that we are in a place where we are increasing testing, and there will be some glitches early in the process where someone may feel like they should be tested and isn't getting tested. So let us know if that applies to you. But we are hearing that if individuals have symptoms of COVID-19, that they will be tested.
Hey Jen, it's Haley with WEAU. With safer at home orders being extended and more events being canceled as the days go by, most recently Riverfest, what would you say to people who are losing hope or maybe not seeing it as important to stay vigilant now?
Yeah, thank you, Haley, for that. That's a very good question. Hope is a really big part of what we have on our side. So I think there are a lot of unknowns with this virus. We know that. We are learning every day a little bit more about the virus. We are improving every day with regards to what we know about it, our ability to test for it. Even at the national level, talks about vaccine production and new treatments. So we are making progress every day. And I think that is a reason to keep hope that even in the midst of feeling like you can't change your behavior from this restriction of movement and requirements through an order that can feel like it takes away your control, but know that there are improvements happening every single day that are really focused on getting us to a place where we can be more open and doing that safely. So that helps bring me hope. And I would encourage you to have the same hope, because I think we are making a lot of progress. It's just not always easy to see that if you're not in the midst of all of the conversations. But I have hope, and I am encouraged that we are not going to be under a safer at home order for forever. There is going to be an end point to this. But I do want to say also that we need to be prepared and flexible to make sure that we don't let this virus win. So if this virus decides to flare up again in the future, we need to be flexible to know how can we sort of tighten back down a little bit. And I'm not saying that that means an entire safer at home order with all of those same levels of restriction, but I think those are the kinds of plans that we're working on right now, state and like I'm part of a regional group that's trying to support making sure that there's data at our levels to help our residents understand what we're looking at and how that plays into the actions we recommend. So it can be more visual and present to allow people to see why we're making those decisions. And so I think, we're making progress. We need to remain flexible and understand that the virus may peak again in the future. We may have to, loosen and tighten this nozzle or whatever analogy you want to think about. And if we can do that, we're going to come out of this and we're going to see less deaths in our state, less hospitalizations in our state, less negative impact overall in our state. That's what we're shooting for. We want to make sure that we have as positive an outcome as possible at the end of this, whenever that is. And I have hope because we are making progress towards that every day.
Justin with WKBT here. You kind of answered my question a little bit, but I wanted to kind of get this across here. I know in some areas of our country, they've had kind of more of a laissez-faire kind of approach to this virus and maybe not enforcing the stay-at-home order that much. And I know some area governments are maybe kind of trying to fight a little bit. I guess what would that mean to Wisconsin as well as our surrounding states if let's say Wisconsin were to kind of just lift the order completely or just have very minimal restrictions, as well as maybe our surrounding states? What would that mean for Wisconsin as a whole, as well as all of the people in our surrounding region?
Yeah, so we see municipalities and local areas across our state in small pockets that want to open up more quickly than the state will allow. While I understand where that's coming from, I also have a chance to see the other side of this, which is the risk level with the virus. There are a lot of asks for human behavior changes, and that's really difficult for myself included, as well as I know all of you. But I think if we don't do this right and safely, we are going to see an impact that we don't want to see in our state. So we have to be careful and balanced. It doesn't mean like keeping everything closed for longer than is necessary either, but there need to be data that we need to be focusing our decisions on data and metrics about where are we at any given time, and therefore what needs to be in place in every sector of our communities, whether it's restaurants or county government or individual behavior asks. Where do we need to be with all of those things to keep the risk level in balance? So the risk will never be zero, but we don't want the risk to be so high that we are putting people's lives at risk. We can't do that. We need to think carefully about making sure we can balance the plan and communicate it out so our residents understand why decisions are being made. And I think we need to do that better going forward. So that's what we're advocating for.
Marcus from News 19. We have a viewer who's asking about dental offices. They say they're opening on Monday for dental hygienists who might be concerned about going to work. How could you talk to them about how this could impact their day?
Yeah, thanks, Marcus. We've heard from a number of these individuals with regards to this interest for opening up beyond emergency services in dental care. And we are working diligently to provide guidance, speak with those dental offices, understand more what their plans are, and provide recommendations around the risk levels with those. So we hear that concern, we're aware of it, and we are working to have conversations with those businesses to assure that we are not putting workers or patients at risk.
Justin with WKBT, excuse me. Forgive me if you had already given kind of an update on the 3 new cases earlier this week, but I guess, can you give us any more information about kind of if there was community spread or if they'd been traveling or kind of any specifics on that?
Well, so because we didn't have any new ones today, you're asking me to go off of my memory with these, Justin. So I believe that 2 of those were in their 50s and one of them was in their early 30s. And I know that 2 of them were not related to community spread. The most recent one, I cannot recall if we knew or not, if it was related to community spread. So I will verify this most recent one and we will communicate about that at the media briefing on Tuesday next week.
Is the statewide increase in kind of spike in positive tests, does that reflect more so that there are a lot more positive people with COVID-19, or is it more because of this increase in testing?
Yeah, that's a good question. And I think, I don't know for sure, but when I look at the percentage, when you take the number of positive test results in any given day and you compare that to the total number of tests, to know how many of the total tests have been positive, that percentage is not greatly higher than in the past. And so I think that it is a result of the increased testing and not necessarily that there's a large number of new positive cases. That's more than just the testing increase. But today's increase was significant in terms of the number of total positives. I just don't know if the total number of tests or negative tests was a significant increase from previous days or not, but the percentage remains pretty similar. So I think based upon the information I have, that it is really about increased tests right now.
All right, I'm not seeing any other questions for you today, Jen.
Well, thank you all. I'm sorry this went a little long today. Hopefully it was valuable information for you. We continue to want to be responsive and provide as much up-to-date, accurate information as we can. We're going to be watching carefully with regards to some of the things happening at the national level with the new treatment that you might have heard about. And we appreciate you being with us and And we hope you have a wonderful weekend and get out there with some of the nice weather. Thank you so much, and we'll see you next Tuesday.